both shortens the time to pregnancy and also studies show that it's providing higher success rates.
When it comes to the treatments, what treatments usually do patients from Ireland come to you for?
Generally egg or embryo donation, and also the genetic testing that they would like to perform on their embryos in case of for the women over the age of 35, and also for patients with many failed IVF attempts. So those are the main groups.
Yeah. I wonder if there are differences in terms of accessing the genetic testing between Ireland and North Cyprus.
Actually, I don't know what the genetic testings thing is in Ireland, so I have no idea. Sorry, I will not be able to. But I can say something is separate if you want. In North Cyprus, you don't have to have a specific indication for doing these genetic testings. Okay. So you can undergo these testings just because you would like to learn more about your embryo. So that's possible.
Okay, so you mentioned a big group of patients coming from Ireland are coming for egg donation treatments. Can you tell me how that is organized when you're doing treatment in North Cyprus?
Yes, so the first they need to do some blood tests and some ultrasound checks to see whether there's any pathologies that we should first treat before we start the treatment. But if everything's fine, then we would like them to inform us 1 month before they would like to start the treatment. For example, if they would like to come in June, we would like them to inform us in May so that we can, if necessary, synchronize their cycle with the donor's cycle. And in June cycle, we would need them to have an ultrasound scan. They don't need to come to Cyprus for that. They can have their first scan here. As I mentioned before, they can first perform their ultrasound scan to rule out any cyst, any other pathologies. And then if everything's fine, then they will start preparing for the this endometrial preparation, which is trying to make the uterus ready for the embryo. And roughly around 12 or 14 days later, it depends on the, of course, the donor's ovarian stimulation growth. Roughly around 12 or 14 days later, we would like the partner or the husband to arrive for providing the sperm. And they can come together or they can come separately. We would need the sperm on the same day as the egg retrieval day of the donor. And we would take the sperm, choose them accordingly, and we will give them inside, put them inside the mature eggs. And 5 days later, we would need the partner, the female part of the equation, and then we will do the embryo transfer on day 5. So they can come and stay for 1 week, or they can come separately. It's depending on their schedule.
Okay. So it's either coming together for 1 week in total,
exactly,
or if they're coming separately, how long do they have to stay?
We just recommend them to come 1 day before. For example, like if for example, egg retrieval day will be on Monday, we would need the partner to be on the island on Sunday night. This is just to minimize the risk of any delays with the flights, etc. Since this is an island, just in case there will be too many delays, they may miss the time period for the donor's egg retrieval timing. So we wouldn't want to do that because it would ruin all 2 weeks treatment for the patient.
Okay. Okay. So you mentioned synchronizing the cycles with the donor. I wonder, do you offer fresh egg donation, frozen, or both?
We offer both, but it depends mainly on the couple's schedule. For example, most of our patients, if there is no other reason, then we prefer also fresh, using fresh oocytes, eggs. But some of the patients are coming from United States or Canada or Australia, etc. And they fly all the way from there. And just in case there is a problem with their timings, etc. So they generally prefer the frozen eggs, so that they would know that they will know how many eggs will be on that day or how many of them will be mature. Because when we are using the frozen eggs, then we know how many eggs we have in advance. So that's what some of the patients choose. But if there's no other reason, then generally we try to do a fresh cycle.
Is there any reason why you prefer doing fresh egg donation cycles?
Normally, success rate-wise, the fresh cycles are not statistically significantly, but like slightly higher chance in terms of having a higher number of good quality embryos. But live birth rates-wise, it's not different at all.
Okay. Yeah, so now let's talk a bit about cycles with own eggs.
All right.
How is that organized for patients coming from Ireland?
So again, we would need them to have an ultrasound scan at the beginning of the cycle to rule out any, again, cyst or any endometrial pathologies or any hormonal imbalance. So they also need to do a blood test as well. If everything's fine, then they start their treatment here in Ireland. And then they would need to do another scan around like 5, 6, or 7 days later. Only after we see a response, then we would invite them to North Cyprus. But depending on their schedule, if they also prefer to do their follow-up scans up until the end, they can also do that in Ireland as well. And they can just come here to North Cyprus just for the egg retrieval. In that case, they would just come 1 day before the egg retrieval, so that we will be doing the egg retrieval, and then they will stay like 1 week only. But it depends on their the follicular growth. So if they would like to, for example, come after the second ultrasound in Ireland, then it may be maybe 7 days, 8 or 10 days. It all depends on how fast or slow their ovaries will respond to these medications.
Okay, so it sounds like there's quite a lot of flexibility in how this can be organized.
Yes.
From just going to North Cyprus for a few days up until, I'm guessing, 2 or even 3 weeks.
Yes. Also, if they're going to do genetic testing on the embryo, then after the egg retrieval, they can return back, because we are going to do the embryo biopsy on day 5 or 6. So after the egg retrieval, since we'll not do a fresh transfer, they don't need to wait in North Cyprus, so they can fly back the same day or the following day, depending on their availability. And then if everything's fine, then 5 to 6 days later, we'll do the biopsy and then freeze the embryos.
Yeah, and then the transfer would be later on, right?
Yes, it will be in another cycle, because for the genetic testing results to come out, it will take around like 2 to 3 weeks. So that's why, meanwhile we are waiting for it, we have to freeze the embryos.
Okay. Do you see that patients prefer coming to Cyprus for the entire stimulation period, for that longer time, or do they usually do preparation at home, or is it individual?
It's so individual, because some patients, because of their workload, etc., they don't want to spend so much time in North Cyprus. Totally understandable. So they just arrive 1 or 2 days before the egg retrieval. But some would like to come and enjoy the island. So they come a couple of days earlier, or sometimes they come at the beginning of the cycle, and they would like us to follow the whole process. So it doesn't matter, whichever will be more convenient for the patient. It's all okay.
And do you usually do fresh transfers when working with own eggs, or frozen transfers?
Normally, as a clinic, if there is no other medical reason, then we do fresh embryo transfer. But yes, if there is any high hormone levels, or if there is any risk of hyperstimulation, which is a potential complication in hyperresponders, and or if there will be a genetic testing, or if there's any progesterone level rise during the stimulation before the egg retrieval. In such cases, yes, we do frozen embryo transfers, or of course, if there's any pathology within the endometrium. But otherwise, we do fresh transfer. because it's also both shortens the time to pregnancy, and also studies show that it's providing higher success rates.
What's the availability of donor eggs like in North Cyprus?
In our clinic, we have many donors from different ethnicities and different age group, but in our clinic, we don't accept any donor candidate if they are below the age of 20 or over the age of 30. So in North Cyprus, the laws allows women to be a donor between 18 to 35. But as I said, like, we as a clinic don't accept anyone below the age of 20 or anyone above the age of 30.